Well, let's get more now on the diphtheria outbreak. And infectious diseases physician and one of our health check regulars, Dr. Linny Fwong, joins us now. Hello, Linny.
Hey, morning.
This is a disease that can be stamped out through vaccination, and I think a lot of people may not be completely familiar with it anymore.
That's right.
Can you just explain a bit about what diphtheria is?
Yeah, of course. So diphtheria is caused by a bacteria. So Corynebacterium diphtheria is the bacteria that's involved, and what it causes is two main presentations. There's a skin form and then an upper respiratory form. So this calendar year we've seen more of the skin form, which is where you essentially get a sore or an ulcer, generally on the arms or legs, which is really well defined and then develops this kind of characteristic membrane, almost like a bluish grey appearance. So it has a very distinctive appearance. And then very similarly in the upper respiratory tract, so the back of the nose and the throat, there's a respiratory form which causes, again, that characteristic membrane, and that membrane is the problem. So essentially what can happen is it can block airways, and more importantly, the diphtheria bacteria can release a toxin which can cause effects on the heart, as well as the nerves and the kidneys. And so that is the life-threatening form, and the reason why people are worried at the moment is that there's been an increasing proportion in that respiratory form.
Yeah, this is such a horrible disease. Thankfully, vaccines are really effective and kind of have basically eradicated it. But once you get an outbreak, how can you treat people who are sick with this?
Yeah, that's right. So it's really important to look at vaccination levels, and certainly there has been a declining vaccination rate, and we know that there have been decreasing rates in sort of childhood generally. We know that particularly the populations that have been involved in, 95% of current cases are in Aboriginal and Torres Strait Islander communities where vaccine rates are, lower. So they were 95% in 2020 in 12-month-olds, and now they're about 90%. So there's definitely been a decrease. In terms of treatment, it's really important that people get onto antibiotics, and sometimes we will use the diphtheria antitoxin, but it's really important that we recognise these conditions early. And I guess in terms of this outbreak, it's important from the public health side of things that we're recognising contacts and getting onto them early, watching that incubation period and making sure that they don't develop symptoms. But definitely vaccinated people can still carry the bacteria. They're just less likely to get severe disease that ends them up in hospital or ICU.
So what sort of resources do we need to throw into it now? Is it about vaccines? Is it about antibodies, contact tracing?
Yeah, absolutely. So it's a little bit of all of those things. So the public health response is going to be really important in this, making sure that adults above 50 are getting their booster vaccine, because there has been a lot that has been missed. Going back and making sure some of these remote and very remote communities have access to the vaccine, because that's been a really big issue. And I think this kind of outbreak has highlighted that, where there is less healthcare access and resources, and ensuring that contact tracing and getting people onto antibiotics early so that they don't develop those more severe symptoms.
Linny, thank you so much for explaining that for us.
Thanks,
thank you.